A 3-day training workshop opened on Leishmaniasis, jointly organized by COMSTEC, a global network for neglected tropical disease and Center for Innovative Drug Development and Therapeutic Trials for Africa. Neglected tropical disease are a major health and economic burden in most low and middle-income countries, as the growing cases of Leishmaniasis around the globe, particularly the African region, is a major health challenge which needs to be addressed at various levels. In Africa, Leishmaniasis is endemic to countries mostly in the North, Central, East and the Horn of Africa. Following the opening of the workshop, head of CDT-Africa, Professor Abubakar stressed the need to exploit indigenous knowledge to resolve such challenges. He said for that reason partnership becomes very critical, and the role of the government is in strengthening those partnerships paramount.
This training is extremely important. The primary focus of the training is in building capacity on how drugs are made from natural resources or from chemical resources. More broadly within Africa, making modern medicines, vaccines and diagnostics is not within our trade. So we have a huge amount of indigenous knowledge. We do not have the sufficient knowledge to explore and exploit that. So for that reason, partnership becomes a very critical role. And the role of governments in strengthening those partnerships is paramount.
According to the UNSC report of 2021, 94% of drugs that Africa used are imported. Almost 100% of vaccines were also imported. Addressing the workshop, Pakistan ambassador to Ethiopia, Mia Natif Sharif, said it is very important for Pakistan and Ethiopia to collaborate in scientific field, especially in the healthcare center, to develop treatments and diagnosis for neglected tropical disease as well as other healthcare issues.
It's very important for Pakistan and Ethiopia to collaborate in scientific field, especially in the healthcare sector, to develop treatments and diagnosis for neglected tropical diseases as well as other healthcare issues, because both countries are important players in the region and they are playing important role. Both countries are have a lot of talent in health, in education, in scientific community, in the medical community. Ethiopia is the headquarter of African Union and a very important player in the African continent. And a lot of diseases that are prevalent in Africa, Ethiopia is the center of disease and treatment is playing an important role in Addis Ababa University. Likewise, Pakistan has developed a lot of expertise in pharmaceutical industry, in healthcare industries.
Countries are important players in the region and they are playing important role, he said. I think both countries have a lot of talent in education, scientific community and in medical community.
We have to bring different regions together, different countries together to join our resources, join our researchers, join our pool of knowledge and to find solutions to the difficult problems. Have, this synergy and this cooperation will lead to many good results, and this will promote friendship between people, cooperation between people, and it will enrich us all, in different ways. We have our very good pharmaceutical companies. We are producing 80% of our own pharmaceutical products, and we are, always ready to share those knowledge with the friendly countries in Africa.
CDT-Africa is a research institution under the Addis Ababa University College of Health Science.